Hello, we're
Hi.
Lake.
I'm Patricia.
Rebecca.
And we're going to be talking about fetal heart monitoring and the categories and how they fluctuate.
1 through 3.
1 through 3. Come with us on a journey.
Okay guys, we're gonna teach you how to strip. So first we're gonna look over the variabilities. There's marked, moderate, minimal, and absent. These all go with the fetal heart rate or the ultrasound. For this, you need to know that from dark line to dark line, it's a 60-second interval. With the little boxes that you see, from going up, they're 10 beat blocks. The bottom part of your strip, you're gonna see the contractions. Contractions consist of a baseline, the duration, and the peak or intensity or the apex. With this, it's measured by the toco, and from dark line to dark line again, it's 60 seconds. And the small boxes on here are 5 millimeters of mercury, which do the uterine pressure. So next, we're gonna do veal chop. So category 2 is defined with moderate variability and with variable decels in this picture. So the variable decels can happen with or without the contractions. A variable decel is less than or equal to 15 beats per minute over a less than or equal to 15-second period, but it's it's less than 2 minutes. So variable, you need to remember, is cord compression. For category 1, the definition is moderate variability with or without excels or with or without early decelerations. The fetal heart rate is between 110 and 160. There are no variable decels or late decels. In this, with early, we see that the contraction mirrors the early deceleration, and that's because the baby's head is pushing down on the cervix and getting ready for birth. This category 1, you see accels. With the accels, that means that there's adequate oxygen to the fetus. So we did already say what category 2 is, but this is late decelerations. Late decelerations are placental perfusion problems. This means that the fetus has had late recovery from the contraction squeeze. And you'll see that it is late from the contractions. With category 3, we're going to see absent variability. There is no variability shown with the contractions that are shown. But there could be prolonged decelerations. There is still absent variability, but there is a slight not slight in this example, but there is a deceleration, but the uterine contractions are also looking like they might start to be tachysystole.
25-year-old female, G2P1 at 39 weeks, presenting for contraction pain 6 out of 10 and possible spontaneous rupture of membrane at 07:25. Upon evaluation, all vitals are stable and progress is noted as 5 centimeters, 60% effaced, and 0 station with ruptured membranes. Admitted to L&D at 0900. Fetal heart rate shows moderate variability absent of decels, classifying it as category 1. Prenatal records show no complications.
Nurse Lake is entering the room. Upon entering the room, she performs hand hygiene.
Hi, I'm Lake. I'm going to be your nurse today. Can I please have you state your name and date of birth?
Rebecca Banis, January 16th, 1996.
That looks good. Thank you. How are you feeling now, Rebecca?
I'm starting to get in a lot of pain. I don't want an epidural. I want to try to do this as natural as I can.
Okay, I can definitely help you with that. I'll go over a couple of positions with you in a minute, and I'll help you with that as well. I did want to check your progress first. I noticed you came in at a 5. You're saying you don't want an epidural. I still just want to see how we're progressing. So let's check that very quickly.
Okay.
Okay, how are you feeling?
It's getting pretty painful.
I bet. You are making some progress. It looks like you're at a 6 now, so I did want to let you know though that your baby's heart rate is looking really good.
Okay.
Your contraction patterns are looking good. Your baby's heart rate has moderate variability and is absent of decels, and it's averaging about 160, which is also really great.
So all of that's normal?
All of that is normal, yes.
Okay.
I'm going to go get a couple of things, and then I can come back and we can go over some of those laboring positions as well.
Okay.
Can I get you anything else while I'm out of the room?
Can I get some ice chips?
Yes, definitely. I'll be right back.
Nurse Lake is re-entering the room after performing hand hygiene with the ice chips.
Oh, thank God, I'm really warm.
Okay.
And you said that you were going to help me with new positioning?
Yes, I have your ice chips, so you can definitely snack on these.
Okay.
All right, Rebecca. So I want to help you. I think if you're open to it, we could try something where you squat on the side of the bed.
Okay.
That's going to help to move the baby down, open you up, and hopefully relieve some pain as well.
Would that, I know the baby's heart rate's doing okay now, but will that help, will that change the baby's heart rate?
It should not. It's with you, like the better you're handling all of your pain during this, the better the baby's going to be off as well too.
Okay.
It's not going to have any, it shouldn't have any adverse effects on the baby.
Okay. Okay, I'd like to try that.
Okay. So I'll help you over here. All right. Here we go. Do you want to come around to the side of the bed? Yep, just over here. Perfect. All right. And then just hold on to the bar and see if you can, yep, and get a nice little pulse going. Yeah. Okay, how does that feel?
It feels a little better. It feels like I have less pressure.
Okay, great.
After about 10 minutes, Nurse Lake enters the room after performing hand hygiene.
Hi, Rebecca.
Hi.
How are you feeling?
I'm still in pain, but it's, again, the pressure, it feels like I'm gaining more pressure.
Perfect. Okay, so because I'm feeling, or you're feeling more pressure, I'm gonna check your progress again.
Okay.
Let me help you back onto the bed. Okay.
How is my baby's heart rate?
It's looking really good. It didn't have any changes during, that was like awkward timing. I pulled the blanket up and you're like, how's my baby's heart
Mom,
rate?
I don't think your mom cares.
All right, I'm gonna check your progress, okay?
Okay.
All right. So it looks like you're definitely progressing.
Okay, where am I at?
You're at 8 centimeters, and your baby is also moving down. It's becoming more engaged. It's at 0 station, and you are 95% effaced.
Okay, and so with that, in that position, was my baby's heart rate still?
Yes, your baby's heart rate didn't have any decelerations with that position change. You're still looking very good. Still moderate variability and absent of decels.
Okay.
Heart rate is averaging around 160.
Okay, thank you.
Okay.
Nurse Lake called the doctor, and as the doctor arrived, Rebecca was ready and dilated to 10 and ready to push. Fetal heart rate remained moderate with variability and was absent of decels, making this birth category 1 throughout labor and delivery.
21-year-old female, G1P0, 39 and 2, patient presenting with frequent contractions and pain 6 out of 10 with contractions. Vaginal exam showed 3 centimeters dilation, 60% effacement, and -2 station. Membrane intact. Admitted to the labor and delivery department at midnight 04. Patient labor in tub with intermittent monitoring. Fetal heart rate shows moderate variability and is absent of decels. A category 1 finding. Second exam at 0604 showed 6 centimeters dilation, 70% effacement, and a -1 station. Memories intact. Patient requested epidural at this time and was given an IV bolus of lactated ringer and vitals stable prior to administration of epidural at 0646. About 20 minutes after administration, the nurse notices that the fetal heart rate strip is recording a prolonged deceleration with minimal variability and begins interventions to improve the category 2 fetal heart tracing. Nurse Lake performs hand hygiene and enters the room.
Hi Mom, my name's Lake. I'm going to be taking over care for you today. Can I have your name and date of birth, please?
Yeah, it's Katie O'Connor, 11/14/2001.
Thank you, Katie. How are you feeling?
I'm feeling much better now, thank you. The epidural helped. I don't have any pain.
I'm happy to hear that you don't have any pain. Baby's heart rate is going down a little bit though, and I did want to reposition you to help get that back up where it needs to be.
Okay, is he okay? Is everything fine?
He is. He's doing good. When we get epidurals, that can cause a drop in blood pressure, and that can also cause baby's heart rate to go down a little bit. It's common, but these measures should be all we need to take to get it back up where it needs to be. I also did want to put some oxygen on you, just to give him an extra supply while we're waiting on getting that heart rate back up.
Okay.
How does that feel?
Feels fine. I'd like to get some rest though. Really tired.
Okay, Katie. I will be back if you need anything. Do you know where your call button is?
Yes.
Okay, let me know. I'll be back, okay?
Alright.
After 10 minutes, the nurse notices that the fetal heart rate has improved slightly, but has not yet returned to baseline. The nurse prepares to administer another bolus of 1,000 milliliters of lactated ringer. After performing hand hygiene, the nurse re-enters the room.
Hi, Mom. I know you're resting. Can I have your name and date of birth again, please?
Katie O'Connor, 2001.
Thank you, Katie.
Always so expensive.
They all are. Thank you, Katie. So baby's heart rate is improving, but I did just want to give you some more fluids, and that should be the last boost we need to get his heart rate back where it should be at.
Well, if baby's doing fine, why do I need fluids?
We gotta keep you on your side for now.
Ugh.
Let me help you. Baby is doing, so his heart rate is doing better, but like I said, with the epidural, it can be common for your blood pressure to drop, and that also can make his heart rate drop. We try and compensate for this before we even start the epidural. We give you fluids beforehand, but everybody's different. Some people need extra fluids, so these extra fluids should help get your blood pressure back at its normal, and that should help get baby's heart rate back to his normal.
Okay, that makes sense.
Let me just hang these and connect them. All right, all finished. How does that feel? How's your pain?
I'm feeling a little contraction on this side, but it's still comfortable, manageable.
Okay, if there's anything I can do to make you more comfortable, let me know. In the meantime, I will be back to check on you, okay?
Okay.
Okay.
At the nurse's station, the nurse, Lake, observes fetal heart rate improvement to baseline and regain moderate variability within 10 minutes and remain absent of decelerations for another 20. Nurse Lake returns to the mother's room after performing hand hygiene.
Hi, Mom. I just wanted to let you know the baby's heart rate is looking great. It's back where it needs to be. It looks like it's going to hold steady. I'm going to take this oxygen off since we don't need it anymore.
Okay, thank goodness. Can you take this pillow out? Because I'm really uncomfortable. I'm trying to watch TikToks.
Yeah, since your vitals are stable, we can definitely remove that for now. Everything's looking good.
Okay, thank you. It's much better.
Okay, let me know if you need anything else. I'll be back to check on you soon, okay?
Okay, sounds good.
5 minutes later, back at the nurse's station, Nurse Lake notices that the fetal heart rate began experiencing variable decelerations with removal of the pillow and returns to the patient's room after performing hand hygiene.
Hi, Mom. I just wanted to let you know that it looks like baby's looking a little sleepy since we took the pillow out, so I'm going to help position you back up on your left side.
Okay.
And this should help just keep baby's heart rate where we need it during labor, okay?
Okay, that's fine, as long as he's okay. Whatever works.
Nurse Lake returned to the nurse's station and observed fetal heart rate return to baseline with moderate variability and remained absent of decels for the remainder of labor. Labor progressed as expected, and a baby boy was born vaginally at 16:56 with no complications, a 1 minute AFGAR of 8 and a 5 minute AFGAR of 9.
A 35-year-old female G2P1 at 39 weeks gestation presents with contraction pain 6 out of 10 at 0800. Upon admission, the patient was evaluated and found to be at 6 centimeters dilated, 90% effaced, and 0 station. Upon receiving prenatal records, no complications noted, and patient negative for group beta strep. Initial assessment shows maternal vital signs within normal ranges. TOCA was placed, and the average fetal heart rate was 150 beats per minute. Patient was given IV bolus of lactated ringers and given an epidural. In the last 10 minutes, the nurse has noticed the fetal strip showing recurrent variable decelerations with moderate variability, which is a category 2 finding. The nurse enters the room to begin interventions and intrauterine resuscitation measures in an attempt to bring the fetal heart rate back up to a category 1. The nurse enters the room and performs hand hygiene.
Hi, my name's Rebecca. I'm going to be your nurse today. Can you go ahead and give me your full name and your date of birth?
Katie O'Connor, 1985.
Okay, Katie, so I'm coming in right now because your baby is having some decelerations, and what I need to do is go ahead and position you on your left side.
Okay, my baby's okay though, right?
Baby is fine right now, so a decel is when the baby's heart rate goes down 15 beats per minute at least from their baseline, and that can happen with or without contractions. But what I think is happening right now is that baby is either laying on the cord or holding the cord that's making its heart rate go down.
Okay.
So let's go ahead and reposition you on your left side. 1, 2, 3. Okay, how do you feel in this position?
I feel okay. Is my baby okay?
Baby's heart rate is actually going back up right now, so this position looks like it is helping. So I'm going to go ahead and leave you here for about 15 minutes, and I'll be back in 15 minutes, okay?
Okay.
Do you need anything before I leave you?
No.
Okay.
15 minutes go by, and recurrent variable decels have resumed. The nurse re-enters the room to continue patient care. Upon re-entering the room, the nurse performs hand hygiene.
Okay, Miss O'Connor, so the baby's heart rate was looking good with repositioning, but the variable decels have come back, so I'm going to go ahead and reposition you on your other side really
Move
quick.
again?
Yes. We have to move as much as we need to get baby's heart rate looking good. I'm also going to give you fluids, and I'm going to be giving you oxygen, okay?
The nurse administers 1,000 milliliters lactated ringers and administers 10 liters of oxygen by non-rebreather face mask. The bolus and oxygen usually take about 15 to 30 minutes to make any improvements.
So we're going to wait for the bolus to be complete, and then we're going to see where you're at.
Okay.
After 20 minutes of observation, the nurse notices on the strip that the recurrent variable decelerations with moderate variability have now progressed into absent baseline variability plus recurrent variable decelerations. The category 2 fetal heart rate is now a category 3. A sterile vag exam was performed, and the patient is now complete 100% plus 1 with a bulging bag. Nurse notified the doctor of sterile cervical exam and interventions performed. Due to the patient's progression, the physician has allowed for an expedited vaginal delivery. The patient delivered at 12:30 and is now resting comfortably. The neonate is with the NICU team bedside, who are preparing for transport.